Welcome to our second session of our interactive component of 30 Days to Natural Diabetes and High Blood Pressure Control. I'm Dr. David DeRose. Well, it's been a journey already, and I've been hearing from a number of you. You've been telling me about some exciting experiences. Some other folks have said they've been having some challenges the first week of the program. This is officially day number 7 in our 30-day program. So if you're just jumping on board, we're glad that you're joining us. And I've been excited to just see the enthusiasm of people. Someone came up to me who's been attending in person and shared their enthusiasm for how the program's been making a difference for them. Someone else was talking with me over the phone. They were very excited about putting into practice some of the things and actually changing their lifestyle already. Hopefully you've been having a great experience. If not, that's why we're here to help you each week. I've got to tell you, though, as we begin tonight, about one of life's great tragedies. Really, it's a great tragedy. And some of you, no doubt, have heard the stories where you'll be hearing the news, and in one place, there's just terrible drought. And in some other place, there are torrential rains. And you just think to yourself, isn't there some way that you could just redistribute that rain from the place that's getting too much, maybe flooding, to the place that's in drought? But I want you to think about that analogy just for a moment and say, what would happen if those two settings were only separated by a single road? Now, I know some of you are saying, well, that can't happen. Even on the top of a mountain, if you've got a road, you can't have drought on one side and flooding on the other. But I want you to imagine a setting where one person is suffering and a person in close proximity to them is suffering, and the solution is just, so to speak, a handbreadth away. Now, that may seem like a strange illustration, but it's actually talking about an epidemic, dare I say it, a pandemic in the world today, and it's a pandemic of loneliness. Think about it just for a minute. Think about it. How can it exist? How can you have two people in an apartment complex, next door neighbors? How could they both be lonely? Have you ever thought about this? But we're dealing with an epidemic of loneliness. And tonight as we begin, it really, thinking about this, brings us into a component of the program that some of you have been engaging with. Maybe some of you want to take this up to a higher level, but I want you to pay attention to something that grows out of an initiative in the United Kingdom about loneliness. We're going to roll some video footage right now looking at this.
So they've taken my phone off me and my tablet and my smartwatch.
It's still early doors, but so far it's been remarkably quiet. I just fell asleep on the sofa in front of the television. When I woke up, I had that instinctive reaction to check my phone, which is just a normal thing to do, and obviously it wasn't there.
It's been a bit lonely, but it's not been unbearable. Being used to living with lots of people as well, it's a big difference.
Usually when I wake up, I check the news apps on my phone to see what's going on in the world, that sort of thing. I think it's not so much about the technology, I've realised, but it's about the feeling of having a connection. I can hear the people in the neighbouring flats heading out in the hallway off to do something a bit more exciting, I imagine. I'm quite jealous of that. I'm starting to find it quite difficult, to be honest. I can't sleep at all. It's almost like I'm not mentally prepared for bed because there's not been a beginning, middle and end. It's just been a constant nothingness.
Morning. So, on the bright side, today's the last day.
I'm just counting down the hours now.
And I've just kind of gone into robot mode. If you start overthinking things, you start thinking about how lonely you are. I'm supposed to do these video diaries, but I don't know what to say. Call your mum, I suppose.
DeRose?
I am, yes, nice to meet you.
Hello, John.
How are you doing?
I'm very well, thank you. Come in.
Thank you very much.
How did you survive?
It's a good question. It was certainly trying, certainly very trying at times, I think. A real sense of being left out and being alone and not being part of it and being very cut off.
It's not something you think about, is it, until it actually happens to you. And then suddenly you become aware of it and realise the significance of what goes on in the world and how many people are lonely. I was bereaved
Right.
2.5 years ago.
Oh, right.
Not having someone to talk to hug, to share things with. The more elderly people, particularly, it's part of life. I can promise you that it can be devastating.
How do you think we can combat it?
The answer to that, probably the key would be to be aware of people, to talk to someone in that situation who is lonely. You have to, it really requires a little effort, doesn't it? I think that's the key. That's the key.
So what do you think? Loneliness. It's a real problem, isn't it? And the tragedy, like I said, is how can there be two lonely people in close proximity? Here's why I'm asking about it tonight. Whether you are using the free videos like many of you are, I know some of you are using the Methuselah Factor book that has the same daily challenges. Day 5's goal was what? Connect. That's exactly right. And many of you have already connected with someone, a partner, as you're going through this journey. I want to try to expand your mind. And I want to tell you that you can increase the benefits of your program and the impact of your program on other people by connecting with someone who you think might be lonely. It doesn't mean you've got to be in touch with them every week, but share something that's happening in this program with maybe someone you haven't reached out to in a while. Maybe it's a family member. Maybe it's a neighbor in your community. Maybe invite them to jump on the program as well. But as you share what you're doing, this increases the likelihood of your success and extends the blessing in your community. Well, if you're trying to point someone in the right direction, or if you're like some of the folks that called me. By the way, this is the first time we're doing this as a live interactive program. The videos have been out for several years, but we've never done it in this fashion with a live component and having people go through it as a group on a day-to-day basis. So we've had a few glitches, just like we had a few challenges in this program. We've had them in some of the links that have gone out to you. I heard from several people. They said, one of my links is not working. In fact, I checked out a link that wasn't working, and the technical team scrambled and fixed that. So some of you said, well, all my links worked. Well, maybe you didn't click on it as soon as it came out before we realized there was a problem. Here's the deal. If you're going through the program day by day and you have a problem with the link, or you don't get a text, or you don't get the email, the place to go is simply fortwayneadventist.org/30 days. fortwayneadventist.org/30 days. Every day on that landing page, we're adding a new video. The video for that day will be there. What else are we putting up? Before each evening's program, we put up handout materials. Those of you that are here live, you got those when you came into the facility. But for others, if you're watching from a distance, your program coordinators, if you have a program host, someone who's doing it in their home, in a faith community setting, they perhaps printed out those handouts. But if you want to get the electronic copies for yourself, simply go to fortwayneadventist.org/30 days. So tonight, we've got some other special things for you. And you say, well, if I'm going to share things with someone else, if I'm going to call a lonely person, if I'm going to keep connecting with a partner, remember, all of you, if you're following the program, we say on day 5, well, let me just do this. If you've got a copy of the Methuselah Factor book, and I'm turning to actually day 5. The way this book works is you add 14 to the day of the program, and that's the chapter number, because the first 13 chapters are talking about the power of the Methuselah Factor, and then I'm adding 14 to 5. That gives me 19. Here's chapter 19. Let me just read what the goal, how we articulate it. Today's challenge: connect with someone else in a way that relates to this program. And we recommend that you do it at least on a weekly basis. Okay? At least on a weekly basis. So that's connect, day 5. Now you say, why have I put up another review slide for you? Because some of you have been talking with me. You've been interacting via text. You've been communicating via our website. And you've been raising questions to us. There's nothing better than sharing your goals, but we've had some questions about goals. So let me look at some of them with you. Here's one of them. Someone asked us, they said, my blood pressure is 95/65. How much can I expect it to drop? Now, let me just tell you, 95/65 for a healthy young person is a great blood pressure, okay? If you're on blood pressure medications, this is probably already too low. Okay? Now, I'm not trying to get between you and your physician, but typically, we don't want to treat blood pressure down to 95/65. So we're not trying to get your blood pressure lower at 95/65. Here's the interesting thing. If you tend to run lower blood pressure, getting on a healthy lifestyle, I've never seen it cause worse problems as far as blood pressure. I've never seen someone end up in the hospital because they ate too much broccoli and exercised and had beans every day. Are you following along with me? Okay? So the point is, I don't think you need to be afraid if the doctor said, well, your blood pressure runs kind of low. Let me tell it to you this way. There's a whole list of problems that go along with high blood pressure. And I know some of you have been following along in the blood pressure book. We have a graphic there that I didn't come prepared to project for you. But it's got a list of many of the leading side effects of high blood pressure. And you find it there early in the book. In chapters 1 and 2, we've got a lot of material about the dangers of high blood pressure. And let me just mention a few of them. These are the dangers of high blood pressure. We have stroke on the list. We have dementia. Running higher blood pressure increases your risk of losing your cognitive abilities. We have heart attack. We have aneurysms. That's a ballooning of the vessels. If any of you actually have the book, this is figure 1.4 that I'm looking at. Kidney damage, eye damage, prostate problems in men. Now, why I'm running through that list with you is because there are some things that are more common in people who have blood pressures like 95/65. So let's say you're healthy, you're young, healthy, active, on a good lifestyle. This is a fine blood pressure. I'm not worried about it at all as a physician. But there are two things that I have found consistently in people with those lower blood pressure readings. One is they tend to have cold hands and cold feet. Okay? So you may just have to put on your gloves a little bit earlier and maybe wear an extra pair of socks. Believe me, this is better than a stroke, a heart attack, or blindness. Do I need to point this out for you? The other thing that they can be a little bit more prone to is if they get up quickly, these individuals can get lightheaded. Okay? So we just say, make changes in your posture a little bit more slowly. If you're in bed, don't just jump out of bed as quickly as you can. Take your time. And these are the two main problems that we see. So blood pressure in these numbers, with these numbers, if you're healthy, not concerned at all. How much should you expect it to drop? Well, here's my point. Don't make that your goal to lower it more, because we don't find that blood pressure lowers significantly. It's not going to drop 17 points. I could pretty much guarantee you if your blood pressure is 95/65, okay? It may actually even be up a little bit if you're getting healthier and doing other things. Okay, next question. Your goal is weight loss. How often should you be weighing yourself? Now, this is a sticky one. We generally, as a rule of thumb, say never weigh more than once a week. But why it's a sticky one is, especially women during their reproductive years, as they get to the time of their menstrual cycle, they tend to retain more fluid. And this can be very disheartening. So let's say you kind of started this program in about middle of your cycle, and over the next couple of weeks, you may be retaining more fluid and gaining water weight. So I just want to remind you, don't get discouraged if weight is one of your goals and you don't see it changing. Do any of you know how much water weighs? How much does a pint of water weigh? That's exactly right. A pint of water weighs a pound, okay? That is a lot, okay? And so just fluid shifts, just what you drank that day, just the time of eating. So don't get too overly preoccupied in a 30-day program, but we do see people, if you're following this program, we do typically see them losing significant amounts of weight if they are overweight. So again, the answer to this, how often should I be weighing myself? Not more than once a week is my recommendation. Now, I have to tell you a story. This is something that someone shared with me this past week since we started our program. This individual has been measuring their blood sugars, okay? What they had not been doing, by the way, this is pretty common. If you're tuning in or if you're here today with with not just high blood pressure, but with high blood sugar, if you have diabetes, I've noticed that many people with diabetes, if they're checking their blood sugars, they might be pretty good with checking them first thing in the morning. But I noticed that many people never check their blood sugar after their meals. And this is a critical time to check it. So this individual heard what we were talking about and got that concept. Check your blood sugar 2 hours after a meal periodically. See what's happening with your blood sugar. And she found, lo and behold, that when she ate one of her favorite breakfast cereals, Raisin Bran, it dramatically raised her blood sugar. So what do you think she decided to do? Leave off the Raisin Bran, okay? So you can make these connections yourself. One of the things that stabilizes blood sugar are beans. So she wouldn't have to necessarily leave off all the Raisin Bran. Maybe just eat regular bran flakes and put some fruit on it and have us some beans. And this can really address the issue, okay? So just by measuring, it can help you be more successful in this program. Well, the other thing that can really help your success, if you haven't been catching on, is sharing your success. And like I said, some of you have been doing that. Sheila Adams came up last week to share with us, and Sheila's here tonight because she's going through the program again. Sheila, I want to invite you up, and Beth is also joining us. So Beth Stevens, why don't you ladies come on up, and we're going to sit down and visit together. Thank you for being willing to share your journey with us.
Thank you.
I'm interested to hear from Sheila, first of all, because folks heard about this dramatic progress you made. You had a copy of the book, The Methuselah Factor. You shared that with us last time. You put this into practice. And for those who didn't catch your sharing in our first session, just kind of quick bullet points. What kind of things did you accomplish in 30 days with the same 30-day program we're featuring here?
Okay, what I accomplished was I had a blood pressure of about 160/90. And in the 30 days, the blood pressure did go down significantly. It went down to normal, which is 120, 120/80.
Wow.
And I didn't lose all of my weight in that first 30 days, but I lost about 15 pounds in that 30-day period.
Great. Okay.
And it took me, as I went further into your program, I lost more.
Excellent. So you got enthusiastic about doing the program again and going through this group program. Why did you decide that? I mean, since you've already learned some of the components, why did you think another 30-day program would help you?
Well, what I wanted to do is get off of the blood pressure medicine altogether.
Okay.
And any other meds that I'm currently on, which I do have something to report to you today.
Oh, really? Tell us.
I was on an arthritis medicine for my knees, and I am currently, as the start of this program and doctor supervision, I am not on that medication. That was a pill form.
Wow. Are you feeling worse?
No, I was the first couple of days.
Okay.
But right now I'm doing fine.
Really? That's exciting.
And that is because of the increase in activity.
Uh-huh.
Once I started moving more, and each day, it wasn't just I did a day, skip a day. I did every day.
Excellent, excellent. This is one of the key concepts in the program, is to try to do something exercise-wise, activity-wise, every day. And it's a really interesting concept. In the old days, we used to tell people with arthritis that they shouldn't exercise. And now we know, especially for people with all kinds of we call them arthritides, all kinds of different forms of arthritis, exercise is typically beneficial. So that's great. That's exciting. Now we've got Beth sitting up here next to you. Now some folks may recognize you because you're one of our team who's been answering the live questions. And by the way, if you have any live questions or comments, if you have a success story or some comments you want to share, we've got people monitoring both YouTube and Facebook during this presentation. Share with us because we'd love to hear your stories of success as well as some of your challenges. But Beth, so you're part of the team.
I am.
And you're also going through the 30-day program.
I am, yes. It's been quite, it's exciting, and it's also a great way to make a connection with your food. And I know that sounds odd, but I love to garden, and I like to grow a lot of my own food, and so it's a good way to bring the two together. The closer that we get to our food source, the better. The more plant-based, the better. And then, of course, when Sheila showed last week her weight loss, I was on board for sure.
Okay.
So Sarah and I, my other partner that moderates with us here, we decided to team up together and keep each other accountable, do the buddy system, and see if we could drop those pounds that we wanted to lose.
Okay.
I have relatively good blood pressure. Well, I think I shared 120/61 was my reading this week, and that was after I had exercised
Excellent.
for over an hour. So it's working. It's a fabulous program. There are certain things that you can't do, but rather than focus on the can't do this week, what I said, well, there's an alternative. I'll just figure out the healthy alternative to it. And so that's where we are with the whole program.
Good.
Yes.
So how about this time around, I remember, Sheila, you told me that you wanted to do something a little different to share your results more broadly. Tell us a little bit about what's going on with that.
Trying to think, what did I do differently?
Well, I thought you said something about a blog or a video log or something, or a diary.
I started a blog the first day of the program. That morning I got up, I weighed in, I did blood pressure measurements, and I videotaped my entire day, and I've been videotaping since that because this journey for me is going to be a long journey. It's going to be over maybe a year. And because weight loss and blood pressure control is my ultimate goals. And by blogging, it'll show everyone that the program does work if you focus on the principles that are set forth in the book.
Okay, well, this is exciting. So can people access this?
I haven't put it up yet.
Okay. Well,
I might need some help from the crew.
Okay. Well, you've got us all interested here, so we're going to be looking forward to seeing through your eyes some of the progress. And then, Beth, any challenges this week for you? You mentioned, you've had to rearrange some things, but anything special that you think others might relate to or might be encouraging?
Well, I have a great love affair with coffee and a creamer that is probably all corn syrup, I'm pretty sure, and a few things I couldn't pronounce.
Okay.
And I know those are not good for me, but I've had to surrender and say that's not what I need to be doing. So
Wow.
A reduction, I will confess, not a clean cut from my coffee, but I'm down to 1 to 1.5 cups a day, looking at a girl who would consume 4 in the morning.
That is huge.
So it's a big cut.
And that's in keeping with the principles. For the caffeine principle is not that you have to make a clean break, although that is the most powerful for blood pressure and diabetes. But we're not trying to pull everything away from you. We're trying to point you in the right direction. I'm excited. That's huge. What I found so interesting as a physician over the years is how many people that actually lose significant amounts of weight by decreasing the amount of calories they drink.
Yes.
In those creamers and the sugar. I was talking with a patient, and they said, well, I only put 2, teaspoons of sugar in my coffee. And I'm thinking, 2 teaspoons of sugar, that adds up, over the course of a month or a year.
Boy, it does.
Yeah, so I remember one patient I had, I've mentioned him in several settings, but he came in once, he's a big guy, but he lost like 50 or 60 pounds. I said, what did you do? And he said, well, I just stopped drinking the soft drinks. Mm-hmm. So the caloric beverages are huge. We'll get to that point a little bit later in the program. Right now it's the caffeinated ones, but you're getting that benefit too by cutting back on those beverages. So anything else that you think might be encouraging this week, things that you've negotiated that you think might be of encouragement to those either in our audience live here or tuning in?
Don't give up.
Don't give up. I appreciate that message.
Yeah.
Just
Perfection's
keep
not
going.
necessary.
Just keep going. It was challenging for me, coming from a background of being an athlete, that I'm now at this stage of my life. And this is making a dramatic change for me. That activity was the biggest challenge because I had to get moving, because I sit every day at my job. So I had to get up, and so the body wasn't cooperating. But I kept going. And just don't give up. It works.
Wonderful.
It does. I would say engage in the exercise, especially right now. I'm a girl who loves the cool fall mornings.
Okay.
And-
No, it may have raised some eyebrows because day 7 is what is it? Rest and reflect?
Yes.
So some people say, well, this sounds like, you're trying to put something religious in our program. It is true in this program, every 7th day, we use this time-honored principle of having a day of rest. But this isn't something that just gives benefits to people who are religious, if you will, in the externally religious way. It just has power to take a day off. It's basically how we were designed. Other people say how we were created. The whole point is simply this. We actually have an opportunity to give ourselves a break once a week, and it's powerful because we're driving ourselves so much. So really take advantage of that principle. Every 7th day, we're going to focus on some spiritual dimension. I'll talk more about that in tonight's presentation. One last thing for you, Beth. We've got folks, like I said, who are monitoring the chat function in YouTube and in Facebook. Anything special for someone who may be a little reluctant? They say, well, boy, if I share something, you're going to tell everyone in the world what my cholesterol was and share all my blood work with the New York Times?
No, we won't do that. We're going to ask a question. We won't identify who you are or where you're from, but we just definitely want you to participate. This is a beautiful forum to get your questions answered, and it's a safe environment. Everybody is attending and participating because they have a concern about blood pressure or blood sugar, diabetes, those kinds of things. So I would encourage everyone to send their questions in. Let's get them the information they need.
Sounds good. Thanks for coming up, ladies.
Thank you.
Okay. So, I hope this inspired you to share a little bit more. And you might be saying, boy, I'm glad I wasn't on camera up in front of a group of people. But remember, the part of the success in this program is connecting with other people. So whether you're coming to a live venue, if you're not at a live venue and you'd like to find one, remember we shared an email address, and that is victor.DeRose, same last name as mine. And if you didn't make the connection, that's my son, victor.DeRose@yahoo.com. And we'll have our team there if you want to reach out to them. They might put that in the chat for us on YouTube and Facebook. So victor.DeRose@yahoo.com. And Victor can help you connect with a local group. This program is being run in a number of settings throughout the country and even some overseas. So don't hesitate to reach out there. Those of you that are here live, don't leave. If you haven't connected with someone, if you don't feel that you have a partner, someone that you're sharing with, at least once a week, do that. And remember, there's another way to extend the benefits of sharing and connecting. It's think of someone who might be lonely, maybe even lonely for your friendship, maybe haven't heard from you in a while, and share with them what you're doing in this program. Well, let me tell you some other things that have happened this week. You've been dialoguing with me. I've received, I don't know how many pictures. This is true. People have been sending me pictures of sprouts. And one person, some distance from here, we would have loved to have them up front and bring their sprouts with them. But they had never sprouted lentils before. And they were telling me, they were sending me pictures of their sprouted lentils and saying how good they were. And by the way, I brought my lentils in, saw Sonia had them, my wife. She brought them up, and these lentils have been sprouting. I even took a picture too. I'm not going to show you that. but I enjoyed them over the last several days. I've been eating some delicious lentil sprouts. Had them on my sandwich today at lunchtime, and they're really good, and they're really easy to do. If some of you, and I heard from someone, they said, how can we do it? We didn't get enough detail. I have a free video. It's in your handout, okay? In your handout. The handout that you were given tonight, if you didn't get it, it's free online. Just go to fortwayneadventist.org/30 days, and we have the essentials of healthy sprouting. This is an interview that I did with Steve Wohlberg. Steve has a whole course on healthy sprouting. You'll see the link right there. If you're having trouble finding it, just go to my YouTube channel, which is Compass Health Consulting, and just look through some of the videos and you'll find the interview with Steve. I think it's about 15 minutes long, something like that, 15 or 20 minutes, and it'll give you a lot of practical pointers, can get you started sprouting. And that's one of the secrets, remember, to eating more beans. I was having extra beans. I actually had bean soup as well this afternoon, but I also had sprouted lentils on my sandwich. So here's what the handouts for tonight look like. Remember, here's the place you want to go. fortwayneadventist.org/30 days. fortwayneadventist.org/30 days. And if you go there, you'll see there were 3 handouts for today. Those of you here in the house, you've gotten those handouts. They were handed to you when you came in. If you're in another group setting, you got those likely handed to you. But we're going to walk through some of these because they answer some of the questions you've been having. And my team up front here who's fielding your questions, they're also taking questions here from the audience. So we're not actually miking you, but if you have a question, just get the attention of our usher there, and that's Paul there in the red, and give him your question. He'll bring it up to our team up front, and they'll pass it along to me. So let's answer some questions that you had from last week. I actually included some of these in your handout materials. That's one of the great things when we're communicating in real time, that materials that I cover next week can help answer questions that you've been having. And so that's what we've done. So this is an interactive program. It's not just me sitting down and saying, boy, what am I going to talk about for an hour in our next session? So if you notice here, this is what the top part of the handout looks like. We've walked through some of the first things you've interacted with me over the last week. I just shared with you the essentials of healthy sprouting. You'll see that website there. It's under point 2 on your handout. Now, let's go to the next resource. And this answers a question. Someone last week sent in a question. I promised to answer it tonight. They said, Dr. DeRose, would you tell us some good sources of ACE inhibitors and good sources of magnesium and calcium? Well, let's take a look. This is in your hands now. It's in the handout. And this is so exciting. I was so excited. About a decade ago, I was asked by a gentleman. It's an interesting story. I should tell you the story. This fellow worked with churches throughout the state of California. And he was especially involved with health initiatives. And he reached out to me and he said, I found something interesting. There's all kinds of churches that do health events in their communities, and every one of those health events, they have a blood pressure check. Every one of them. He said, but none of those churches have any program for high blood pressure for their communities. And so he reached out to me. He said, Dr. DeRose, would you film 3 one-hour presentations dealing with high blood pressure? And so I did this before the book ever came out. And so we came out with a series, we called it Reversing Hypertension Naturally. Reversing Hypertension Naturally, it's a video series, you can still get it. It was actually produced by Amazing Facts. Some of you know Amazing Facts, I'll tell you a little bit more about them. But Amazing Facts produced it. It was a partnership with several ministries, an institute, Weimar Institute out in California and some others. And while I was doing the research for that program, I came across something that just excited me. I found that there was a whole group of foods that were loaded, or let's put it this way, contained ACE inhibitory compounds. You say, well, what are ACE inhibitory compounds? Among the very best tolerated blood pressure medications today, in fact, I can say it categorically, the best tolerated blood pressure medications today work on a hormonal system. And one of the hormones in that system is the angiotensin converting enzyme. It's involved in this system. It's the renin, aldosterone, angiotensin system. And this hormonal system, if you're taking a blood pressure medication that ends in pril, it is working directly as an ACE inhibitor. So you may be taking something like lisinopril or trandapril or ramipril. These are all ACE inhibitors. There's a related group of drugs that are called the angiotensin receptor blockers. They work on the similar pathways, and these all end in sartan. So if you're on losartan or telmisartan, anything that ends in sartan, that's also working on this system. So here's the interesting thing. In your foods are actually these natural ACE inhibitory compounds. Think about this. How did they get there? My Native American friends, they would likely tell me the Creator put these compounds in the foods to help your blood pressure. And it's an interesting, look at the list up here. It may not project all that well, but what you see is you see broccoli has ACE inhibitory compounds. And you'll see a number of beans or things in the bean family like chickpeas or garbanzos, mung beans, peanuts, soybeans. You can see that mushrooms and corn and potatoes, wheat, garlic, rice, all of these things have natural ACE inhibitory compounds. So here's the amazing thing. When you're eating these whole plant foods, you're getting actually in small doses pharmacologic agents to lower your blood pressure. Isn't that incredible? Now, like I said already tonight, you don't have to worry about eating too much broccoli and garbanzo beans. I've never seen anyone in the ER because they said, you know what, I had a bunch of garbanzo beans and mushrooms, and I got all those ACE inhibitors. You don't have to worry. Isn't that amazing? If you took your whole bottle of telmisartan, you'd be in big trouble, wouldn't you? Okay? Yeah, you would be. Take your whole bottle of lisinopril. This is not good, okay? But you can't overdose on the things that are in the food. So this is a really exciting slide. Now, in your handout, I put the top, we have a great tables in the book, 30 Days to Natural Blood Pressure Control, that look at the top sources of magnesium, calcium, and potassium. And I've just put a bullet point up here to make it really simple. Virtually all of these are plant foods. Now, the only exception is with calcium. And we looked at calcium a little bit differently because a lot of people make an unfair comparison with calcium. They'll say, well, the dairy products are such great calcium sources. But there's a problem. Most of the people I deal with who have high blood pressure or diabetes, they're carrying more weight than they need. So you don't just want to look at the nutrient content, you want to look at nutrition per calorie. And the dairy products don't stack up all that well. So if you want to take a look at some of the actual foods in these categories, this is not the whole table. You've got the whole table in the handout, but just for projection's sake, if you look at the top sources of magnesium in the USDA database, when we published the book several years ago, you can see there are things like rice bran and pumpkin seeds. By the way, pumpkin seeds, take note of that. Don't throw those seeds out. Dry them. A good source, excellent source of magnesium. You can see some other beans on the list. So think of seeds and beans being among the excellent sources of magnesium. Plant foods. Now this is calcium. We've given you a few more options here, but even going all the way down to number 9, no dairy products, you'll see things like tofu on the list, and mustard greens, and turnip greens. You might be surprised. Many of the foods that my Native American friends have enjoyed for centuries, nopales, stinging nettles. These things are very rich in calcium. So are the dandelions that you pull out of your yard. These are good calcium sources, okay? So there's readily available calcium sources. They're in the plant kingdom. Yes, you'll see down the list of ways you will see cheese, but I want to point something out about cheese. Maybe I should just stop on the calcium for a moment. Cheese is high in sodium, and it tends to be high in fat as well. And these are two things that are not good when you're looking at optimal health as far as your blood pressure and your blood sugar, okay? So you want to eat less of the cheese, leave it all out completely. You'd probably be better off. And I'm saying that having struggled with cheese in my earlier years. I grew up as a young adult. I ate lots of cheese, whether you know it or not. 3 of my grandparents were born in Italy. So there was never a day in any of the extended DeRose family that there was not cheese in the house, okay? Always. There's always cheese in an Italian home, at least everyone in my family. But that was a big change for me. But to get away from that, and my health improved as I made changes like that, even years ago. Let's look at this last list, and this is potassium champions. Now, a lot of people say, well, eat more bananas. Well, bananas, actually, I was just dealing with someone this week. Some of you know I do telemedicine. And they were having problems with their blood sugar, and they were eating lots of bananas. Bananas are a pretty effective food at raising blood sugar. Okay, if you're hypoglycemic, it might be a good choice if your sugar's low. But if you have diabetes, you don't want to be tanking up on the bananas. But look at these foods. If you're looking at potassium per calorie, you'd be better off having beet greens or bamboo shoots or Chinese cabbage, bok choy. You can see there, these plant foods, rich potassium sources. Okay? Key message, emphasize whole plant foods. How are we doing tonight? We have some questions coming in this evening?
We do. We have a couple of questions coming in. So, one from our audience today, we have, is there a way to lower high cholesterol naturally?
Okay, excellent question. Can you lower high cholesterol naturally? This is an exciting one because what we find in these lifestyle programs, when we do intensive lifestyle programs like you're going through here, a virtual one, we see dramatic drops in cholesterol very consistently. So the most powerful diet for cholesterol lowering is just what you're seeing here. Now, it's not just exclusively vegetables. This is a picture more of vegetables, but the whole plant foods. One of the powerful cholesterol-lowering foods are beans. So not only do beans help to stabilize blood sugar, they also help to lower cholesterol. So when you get away from animal products, and a lot of people don't realize this, they say, but Dr. DeRose, I'm just using the egg whites and the chicken and the fish. I've gotten rid of the red meat. Well, that's a step in the right direction. But animal protein in general raises cholesterol. Protein, that's right. Take away all the fat, all the cholesterol out of something like milk. You're just going to drink skim milk. Skim milk in and of itself raises cholesterol. So the more you eat whole plant foods, the more you tend to lower your cholesterol. And we have seen dramatic things. I just was dealing with a patient, I think dropped their cholesterol like 100 points, not in 30 days, but making dietary lifestyle changes. Exercise is also an important part of that equation. Other questions?
We do. We have several more. So we have one of our online viewers stating that they have a left ankle that is bone on bone, so walking is too much and it causes them a tremendous amount of pain. They have been walking 1 to 2 miles a day, but they're asking, is there anything with this new lifestyle that will make their ankle or that cushion come back and the pain more bearable?
Okay, so this is a difficult question. You know, it's talking about arthritis and are there things that can regenerate cartilage. There is some suggestions that there's a number of things we can do that can improve cartilage health. And what's really interesting is some years ago I was talking with an orthopedic surgeon, and he was saying, you know, it's an interesting thing. He said, I'll see someone come into my office and I'll look at their x-rays, you know, these bone-on-bone x-rays, whether it's in the ankle or the knee, and they're doing fine. They're not complaining of pain. And I'll look at someone else and their x-ray doesn't look that bad and they're in terrible pain. And he was not criticizing their perception of pain, is that there's other things that are involved in pain beside just regenerating the joint. And what we know about the kind of lifestyle we're talking about is this lifestyle actually decreases inflammatory compounds in your body. We do have some evidence that the health of cartilage can be improved. Interesting story I tell in the Methuselah Factor book. It also comes from another friend who's an orthopedic surgeon. And he tells about someone who was coming in for hip replacement surgery. They were actually on the table getting ready for their hip replacement, and they had a heart attack. Needless to say, the hip replacement surgery was canceled, and they were brought to the coronary care unit. Well, they got interested in trying to care for their heart better, and they got on a program very much like the program we're sharing with you that's written about in the Methuselah Factor book and the Reversing Hypertension book, 30 Days to Natural Blood Pressure Control, and it's featured in these videos. Person got on this program, and after 6 months, they were doing great. They went back in to see the orthopedic surgeon, and the orthopedic surgeon said, well, you're 6 months out from your heart attack. We can now do your hip replacement. And they said, you know, my hip is not bothering me anymore. Okay? So there is definitely hope. Now, here's what I tell people. If you've got arthritis, the rule of thumb is exercise is too much if you feel worse the next day. Okay? Because if you've got, serious arthritis, just to do some activity may bother you. But if it's not worse the next day, I'm comfortable with that level of exercise that you're doing. So gradually increase things. By the way, in-water exercise, powerful, great stuff. If you got lower extremity arthritis, if you can find a pool, walking in a pool. A lot of people say, well, listen, I'm going to go to the pool, I'm going to swim. Walking in a pool is a very effective way to get rid of edema, fluid buildup in the legs, something that I recommend to patients many times, and we've seen really great results with that. So, yes, there's hope for regenerating cartilage. One bonus point, and that is the anthocyanins. These are compounds, phytochemicals that give a reddish pigment to things. You'll find them in grapes. You'll find them in red apples. You'll find them in tomatoes. The anthocyanins have natural cartilage regenerative properties. So a lot of good stuff in these whole plant foods. So whether you're trying to get ACE inhibitory compounds, whether you want to lower your cholesterol, whether you want to help your joints, it's all the same program. You don't have to say, do I have to do something different? No, just follow this program. Follow the advice of Sheila Adams, who was up here earlier, and just keep moving forward, okay? We got another question there?
We do. Are there any natural ways to get rid of excess water retention?
Okay. Well, we just talked about one, and that is if you're retaining fluid in the legs, it's in water walking in water. Let me tell you how this works. I'll just explain it. It might stick better. So if you're walking in a pool, the water in the pool has weight, right? The greatest weight in the pool is at the bottom of the pool because it's got all that water weight from all the water above it. So the greatest pressure on your legs is in your feet when you're walking. There's a little bit less pressure on your ankles, a little bit less on your calf. It creates a pressure gradient. Things move from high pressure to low. It's actually moving the fluid from your legs up to your kidneys. Now, the only problem is you have to get out of the pool frequently and get rid of the water that's being mobilized because it's going to go to your kidneys, okay? No, really, because it really does work. So that's one natural thing you can do. But let me tell you the other thing. Now, if you've got serious heart failure or kidney problems, you have to work with your doctor. But let's say you don't have that. Actually, for many people, drinking more water actually helps them get rid of excess fluid. Now, a lot of people say, what? How would that happen? Many people are consuming too much sodium, and we're giving you a preview because if you've got the Methuselah Factor book, or if you're looking at your sheet, your goal sheet, what is day number 8? That's tomorrow. What is the goal for day number 8? I need help here because you guys can maybe negotiate this faster than I can turn the pages in this book. Well, I'm here. Day 8, seek low sodium options. Okay? So tomorrow, your goal, the video is going to talk about getting your sodium level down. So here's the thing. There's a correction factor. If you drink more pure water, now we're not talking about drinking juices or something else, pure water, that actually helps to flush excess sodium out of your body. Once you get fully hydrated, then drinking more water flushes sodium out of your body, and that helps to lower your sodium load, which decreases the tendency to retain fluid and also helps to lower your blood pressure. So really exciting stuff, and we'll get next week. You'll find if you go through the week, if you follow Sheila's advice and don't give up. By the way, day 9 is get a grip. These are exercises you can do without using your legs. Focus on fats is day 10. Sleep right, day 11. Day 12, water up. So we've got a lot of these things that you're asking about. You're going to be getting more material about as you go through the daily videos this week. Let me show you just a couple other slides, and then we'll come back to the questions, because we're talking about what's coming up, and you'll see this on your handout. Okay? On your handout, you've got sleep hygiene principles. So I put some things in your hands, not so much for tonight, but for this coming week. Because, did you catch it? On day 11, we're going to encourage you to sleep better. Then you say, well, that's good to encourage me, but I have problems sleeping. Well, we give you 3 pages in the handout of things that can help you sleep better. And there is an extra bonus video in your handout. There's a link. So you've got the regular video that goes with this series, but I have a special videos that go along with the Methuselah Factor book. So you say, well, what's the difference? The goals are all the same, but remember, the Methuselah Factor theme expands the program. It's not just about diabetes and high blood pressure. It expands it. So take note of that. And my son, who does the web for Compass Health, that's my company, he said he's dropped the prices on all the Methuselah Factor resources. So if you, because there is a charge if you want to get all those videos, but this one's up there free for you. That's the Methuselah. So these are professionally produced videos rather than Dr. DeRose just sitting in his office like the ones you've been watching, okay? And if you like those, better than the Methuselah Factor one with the, the professional, graphics and all and people exercising and stuff, then don't spend the money on the Methuselah Factor ones because that's what you'll end up getting. Last thing here that I wanted to highlight, and then we'll try to get a few more questions in. Rest and refresh. That is today's goal. A week from today, remember, every 7th day we're encouraging you to take a day off, whether you consider yourself religious or not. And we do next week introduce this concept of seek spirituality. Because what I find is even a person who says they're an agnostic or an atheist, you know what? We have a spiritual nature. It deals with meaning and purpose in life. So even the atheist has a spiritual dimension. And so we talk about seeking spirituality. Here's why I'm telling you this tonight. Because next week, if you're here at this venue, I mentioned Amazing Facts and how they produced the blood pressure video series that I was in. We actually have had the privilege of being one of the host sites for another international series. It's called Panorama of Prophecy. Some of you were here last night and enjoyed a viewing from that series. Well, next week, we're going to have, to me, one of the most important topics, one of the most important spiritual topics, regardless of what your background is. If you want to hear a compelling description, and I'm saying this to people who don't come from a religious background, this, I think, is one of the most compelling descriptions for why there is evil in the world. Can there even be a God with all the evil that we see in the world? Pastor Doug Batchelor, by way of video presentation, is going to be here in Fort Wayne, okay? So immediately following our program, 7 to 8 p.m. Eastern Time here in Fort Wayne. Then after that, we'll take a short break, probably 5 or 10 minutes, and then Pastor Doug Batchelor is going to be sharing on this important topic. They call it in theological circles theodicy. It's how can, there be a loving God with all the bad in the world? And it's going to be a really exciting presentation. So if you know of anyone who would benefit from that, it's a double feature next week, okay? So it's all included in the same price of admission. Sound like a good deal? Yeah, now you're smiling because you didn't pay anything to come. I understand. But the same price of gas that it took you to get here. You got it? Okay, do we have another question?
We do. Are there any supplements that we should avoid if we are trying to lower our blood pressure?
That is a very good question. Are there supplements to avoid? Why don't we have actually a chapter in the book, the Reversing Hypertension Naturally, or 30 Days to Natural Blood Pressure Control. That's the book, 30 Days to Natural Blood Pressure Control. We have a chapter in the book that deals with that. So I'll bring some high points for you. We've got a whole table in there. There are a number of commonly used supplements that raise blood pressure, but let me confine my comments to just one class of over-the-counter compounds. They're not supplements, but this is the most common one that I see, most common pill that raises blood pressure. They are the non-steroidal anti-inflammatory drugs, okay? So if you're taking an ibuprofen or a naproxen, an Advil or an Aleve, these medications can raise blood pressure in the research as much as 15 points. So you can be significantly raising your blood pressure. But you say, well, wait a minute. I've got the bone-on-bone arthritis. I've got these joint problems. Are I'll try to remember to put this in, and I know my team will remind me. So next week, I'll try to go through some of the things that we recommend as replacements. They include things like turmeric, boswellia, omega-3 fats. We can talk a little bit more about that because some of those things intrinsically also lower blood pressure. So instead of taking a over-the-counter pill that raises blood pressure for your arthritis, if you add more omega-3 fats, they tend to have an anti-inflammatory effect, they can help with pain, and they actually have a blood pressure lowering effect. Any other questions tonight?
We have one more, and I know this is a topic that'll probably be covered next week a little bit more, but it's the impact of sleep apnea, which we can further discuss.
Okay, so impact of sleep apnea. Okay, so I'm putting in my mental notebook. We're going to talk more about sleep next week. I'll go through some of these sleep principles because they're not all covered in the book, but look at them in your handout. We'll talk more about sleep next week. It's a really important topic. As we're finishing up, I want to encourage you with several things. Keep in the loop your medical providers, okay? If you're on medication, be talking with them because some of you are already saying, oh, my blood pressure's coming down, my blood sugar's coming down. You may need adjustments in your medicine. Track your progress, okay? Be measuring something. If it's weight, once a week. Blood pressure, blood sugar, much more frequently, okay? And then make sure you're watching the daily videos. One thing has come up. When we originally filmed these, like 3 years ago, we were offering a promotional to get people to go through the program. We were saying, do it, share your story, and we had a drawing for some gift cards. That promotion's over, okay? So I don't think too many of you have been confused, but if you hear about a free gift card or you said, well, what about these free gift cards? How come, Dr. DeRose hasn't offered them to us? That was a promotion back in, 2018 when we came out with it. Don't forget the website, remember? So I should tell you one other thing. This is important, in addition to the website. There's some other free video links there in your handout. I just remind you of that. But we've taken your questions. That's the free video. Okay, let me just leave this. Let's put this slide up here for you. Again, this fortwayneadventist.org/30 days. The reason I'm putting that up for you is if you have not registered for the program to this point and you want the daily reminders, the single easiest way to do it for most people, you can go to that fortwayneadventist.org, but don't put the 30 days after it, okay? It's connect.fortwayneadventist.org if you want to register. connect.fortwayneadventist.org. If you want to get the daily reminders, we're probably going to only be signing people up for those for a couple more days. Because the idea is, well, if you're jumping into it 10 days into the program, you probably don't want a daily reminder to watch day 11, because you really should be watching days 1, 2, and 3, 4, 5, 6, 7, 8, and 9, and 10 first. Okay? So that's kind of the thinking behind that. So if you've been tracking with the program, you just haven't registered, and you want to get the text reminders and the email reminders, make sure you register for the program. If you're having confusion about it, again, connect.fortwayneadventist.org should do that for you. So I've enjoyed seeing you all here live tonight. I've enjoyed the good interaction. Remember, you can interact with us online as well. Every day, if you're getting the texts, there's an opportunity for you to just click and send us any questions that you might have. That's what's shaping our evening interactive sessions that we've been doing. Session number 3, next week, 7 p.m. to 8 p.m. Eastern Time. Looking forward to having you join us again. I'm Dr. DeRose.